Hi, Dr. Smith. I have a 28-year-old female. She is here for a standard prenatal appointment. She is right at 20 weeks and 2 days along. This is her first pregnancy, and she has no prior history whatsoever, no medical history. And during this visit, she did mention that she has been having some mild intermittent headaches. She describes them as just pressure and painful. And her heart rate and her blood pressure were a little bit off. All of her other vitals were fine, but her heart rate was 112 and her blood pressure was 142/90. So with this information, I was concerned about my initial thoughts on gestational hypertension versus early onset preeclampsia. So I went ahead and did a spot urinalysis on her, and it was completely negative. No leukocytes, proteins, red blood cells, nothing of concern. I also checked out her previous trend of blood pressures, and they were completely normal. And she's a long-standing patient with us too, so going back further, there's no indication of like chronic hypertension either. We don't have any other prior pregnancies. This is her first pregnancy, so I have no history of preeclampsia either. With all of that in mind, and she's denying all of her symptoms, all other symptoms like vision disturbances, sudden weight gain, excessive swelling, I am concerned with the headaches just because my concern is potentially preeclampsia. I know she's only 20 weeks and 2 days along, but I think it should still be something that we consider in the back of our heads. So I think for starters, we should get a CBC, CMP, and a liver function test to at least have a baseline to go off of in case she does end up developing further symptoms and changes to her status. And then I also would like to know what your thoughts are on differentiating between gestational hypertension and early onset preeclampsia, especially when it happens in a patient like this who is right on that line at 20 weeks. What would you use from this information to differentiate between the two? And then also, what other things would you like to add to the plan? I would like to learn more about how to manage preeclampsia in patients early on, since she's nowhere near delivery, and see if there's anything we can do to kind of mitigate the impact of her preeclampsia early on. So yeah, I'm looking forward to hearing from you. Thank you.